Hello, welcome to everyone that's joining us on this live on this episode of the Ask a Doctor series. Welcome, welcome. Please, as you join us, let's know where you're watching, right? Thanks for joining us once again. So, on this episode, Steve, we're going to be discussing the topic high risk pregnancies, the signs, the complications, and the management. And we have with us in the studio, we have a very special guest in person of Dr. Atochi Woruka from Gynae School. He's a specialist in obstetrics and gynecology, and he'll be taking us on this conversation tonight. So please, ladies and gentlemen, if you have a question, just reserve it for the end of these discussions, and we'll take them here and now. Thank you very much. So please join me as we welcome our guest to the stage, Dr. Atochi. Thanks for joining us, sir.
Okay, thank you very much for inviting me for the program. I don't have much to say, but I'm not just of gynoscope, I'm also of the University of Port Harcourt Teaching Hospital. So I
Okay,
also work go
okay,
beyond gynoscope.
okay.
Okay, so without much ado, I prefer to start talking about the topic immediately.
Yes,
So,
please.
high risk pregnancies. First of all, before we talk about a high risk pregnancy, we need to understand first of all what a normal pregnancy is. A normal pregnancy is a physiologic process that starts from conception, is carried for three trimesters, and is carried up to 37 weeks, and from 37 weeks to about 40 weeks, 95 to 98% of women will have a normal delivery, and after the normal delivery, in the next 6 weeks, they'll have a normal post delivery period, what we call a puerperium. Now, a normal pregnancy is not expected to have any problem. Now, we'll not talk about high risk pregnancies. Now, high risk pregnancies are pregnancies that actually, uh, some of them, the risk are predicted before the pregnancy occur. Some the risk occur while in the pregnancy, and some the risk occur after the pregnancy. That is the puerperal period. So to discuss high risk pregnancy, I'll classify. Okay, before I classify this, it's important to mention that pregnancy is a very dynamic process. So a normal woman before pregnancy, they become a high risk woman when she becomes pregnant. And a normal pregnancy at the initial stage may become high risk as the pregnancy continues. A normal pregnancy that has been normal all through might become high risk when the woman is about to deliver during her time of labor, and a normal pregnancy can also become high risk after the delivery, the first 6 weeks, which we call the puerperal. So I will start with talking about high risk pregnancy identified before the conception, before the woman gets pregnant. Now, high risk pregnancies or women at high risk when they get pregnant are women that have hypertension. A woman with hypertension, before she gets pregnant, that pregnancy is already going to be a high risk pregnancy. Woman with diabetes mellitus, woman with a heart condition, maybe heart transplant, woman with any medical condition, any serious medical condition like kidney failure, they are all women that are categorized into high risk. As a matter of fact, there are women that we even advise not to get pregnant because the pregnancy is going to be a problem, a threat to their life, and even can even lead to and even if not a threat to their life, can also lead to fetal loss. Now, so when you see a woman that has a serious heart problem, very poorly managed diabetes mellitus, women with kidney failure, women with very severe epilepsies that are having recurrent seizure. these women are already classified as high risk. Now, these are women that are high risk even before they get pregnant. Such women, before they get pregnant, they should have counseling, and such women should also be managed in a tertiary hospital. Now, another group again of women that even before they get pregnant are high risk are women that have had different abdominal surgeries that included the pelvis and also included making an incision in the uterus. Such women are already high risk pregnancies also. Now, moving to the first period of conception, high risk pregnancies also, a normal woman can become high risk in during the pregnancy if she develops particular problem. The very common ones are a healthy woman initially that was not pregnant, later got pregnant, was normal, and after 20 weeks, she begins to develop high blood pressure, and there is protein in her urine, which we call preeclampsia. Such woman is a high risk, has a high risk pregnancy, and it's very common. As a matter of fact, it is one of the most common cause of death among our women. We cannot talk about high risk pregnancies without talking about preeclampsia. It's a huge killer of women in pregnancy. So during the course of pregnancy, you can see that a woman that has a normal blood pressure begins to have an elevated blood pressure, and when you check her urine, there is protein in her urine. Such women should be referred immediately for further management. In most cases, some of them may also have more referral. They will stay until their blood pressure has gotten so high and they start having convulsions. Some of them, after the convulsions, they develop kidney failure, they develop lungs failure, they have what we call pulmonary edema, they develop heart failure, and some of them develop brain problems such as cerebrovascular accidents and become unconscious and may even die without recovery. Those that recover may also not have a normal renal function. Another common cause again of another common high risk pregnancy again we encounter are women that have had recurrent surgeries, women that have had previous myomectomies, previous cesarean section. These women are also high risk pregnancy. Sometimes in the early part of their pregnancy, they have what we call a placenta previa. A placenta previa is a condition whereby the placenta is not normally situated. It is located in the lower part of the womb and causes the woman to bleed before pregnancy. That can lead to the loss of the life of the woman or the loss of life of her baby. Another one again is what we call abruption placenta. Abruption placenta is when a normal placenta separates before it is time of delivery of the baby, and the woman may not bleed. She may appear apparently healthy. However, as time goes on, her womb gets very hard. She loses her baby, and when she comes for delivery, if she's not properly taken care of or not properly referred, she might end up losing her womb or even her life. So during the course of the pregnancy, these are the common ones you can see. Other less common ones also are women that have heart failure, though lots of them, because of how serious the heart condition usually presents, we they are usually managed already in a tertiary center. So most women with that are well managed. One again that we also see that's not commonly that may come from a primary healthcare center or not even in the hospital is women that have diabetes mellitus. Lots of women may have diabetes mellitus, and they don't even take care of it before they get pregnant. So by the time they get pregnant, they they discover that they have high blood sugar when they begin to have symptoms. However, women are screened for blood sugar, and of course, a lot of them are identified. Once you identify a woman that has a high blood sugar, That pregnancy is not a pregnancy you want to manage in a primary health care center, or you want to just go to a maternity. You need to go to a tertiary hospital for proper management. Other high risk pregnancy during the course of pregnancy might also include a normal pregnancy where the woman begins to see water, she drains like liquor, her membrane breaks, water comes out before it's time for delivery. The baby is preterm. Such woman needs to go to the hospital where they have a special care baby unit to manage such pregnancy. So, invariably, a high risk pregnancy is a pregnancy that during the course of the pregnancy, the normal that you expect changes from what you used to expect to something unusual. It can occur in any time of the pregnancy. There is a very long list, but I want to limit the list to just these few I mentioned because they are actually the most common we encounter. Now, a normal pregnancy also carried till the time of delivery can also change to become a high risk pregnancy. It can occur when once labor starts. Once labor starts, some women they see water. Once they see water, the next thing that follows is the baby's umbilical cord, which we call this cord prolapse. Such women are at risk of losing their baby and should seek immediate attention in the hospital without much manipulation of that cord. That's a very dire emergency. Also, women that while they are in during the delivery they begin to bleed, or the labor is taking so long, although it's no longer common as before, but prolonged labor, obstructed labor are very important issues that we have discovered is that has lots of morbidities associated with it, can lead to the death of the baby, can lead to several problems in the woman, such as the woman having renal failure, having having to have a nerve injury, and even fracture of the pubic symphysis, leading to her not to able to walk normally. So obstructed labor is also something that can become a normal labor can become obstructed, and it becomes a challenge during delivery. Also, you can also have a woman that her baby is not lying well. If the baby is not lying with the head down, that pregnancy is not a normal pregnancy, and as such, the woman should seek care in a tertiary hospital. Now, if the baby is lying with the buttocks, some selected cases, the woman can still have a normal delivery. But if it is lying in such a way that the head is towards one side, maybe the maternal left or right, we call that a transverse lie. Such women can never deliver vaginally. Now, I also forgot to mention multiple gestation. A woman carrying more than one baby is a high risk pregnancy. It's a high risk pregnancy. There is the recent advent of in vitro fertilization, where most women don't conceive naturally, and most times they have multiple babies. So it has also increased the incidence and prevalence of twin gestation and triplet gestation in our environment. Such pregnancies are considered high risk and should be managed as such. Now, there are other intrapartum experiences that a woman can have. Human can be in labor and we discover that the baby's heartbeat is no longer normal. We call that a fetal distress. That's a very high risk pregnancy occurring at the time of delivery. Then, besides the time of delivery, a pregnancy that was normal can become high risk after delivery. If, for example, a woman delivers and the placenta is retained, the placenta is not coming out, it's a very common cause of primary postpartum hemorrhage. And primary postpartum hemorrhage is the most common cause of maternal mortality and morbidity in our environment. So if the placenta does not come out, or it comes out and the womb is not contracting, as the uterus is not contracting, that can lead to bleeding in this woman, and such bleeding can lead to loss of life. even if she had had a normal delivery, a normal pregnancy and normal delivery. At that point, which is the early hours after delivery, the woman can still have a high risk postpartum period, and that can lead to loss of life and even morbidity. Some days after delivery, also women can have infection if they have what we call episiotomy that was not well repaired, or perineal tears and they are not well taken care of. They can have puerperal sepsis. Puerperal sepsis is a very high risk situation. I choose to mention it because most people want to limit the care of pregnancy when the baby is there and when the woman delivers. But puerperal sepsis after delivery is something that is very, very serious. The woman develops infection around the genital, the reproductive tract. It can spread and become systemic, leading to our organs to fail, and can be a cause of death. So I would wrap up this brief discussion or brief talk on high risk pregnancies by saying that uh, maternal mortality in our environment is primarily caused by hemorrhage, and I've mentioned the cause of hemorrhage in the pregnancy and postpartum. Another cause is hypertensive disorders, and I've mentioned to you about preeclampsia and hypertension before pregnancy. Another is infection. That is why I had to bring in pleural sepsis and the rupture of membrane before it is time of labor. These are the most common causes of death in women. And a high risk pregnancy is any pregnancy that deviates from the normal course of delivery, requiring additional intervention or treatment to see the pregnancy through its normal course delivery and the post delivery period. I will prefer to go into details of any of these aspects based on the questions raised, because it's actually a very broad discussion if we choose to dwell in any of this area particularly. So I don't know, moderator. Thank you very much. Let me take the questions now.
Okay, thank you very much, Doc. Thanks for all you shared. Now, for some of these symptoms you mentioned, right, is it possible that it can be detected before they happen? Like either before the pregnancy or in the course of the pregnancy before it comes up? Can it be detected?
Okay, yes, a good number of conditions are.
Can you
First
hear
of
me?
all, I can hear you very well, loud and clear. Now,
Okay.
in the course of before a woman gets pregnant, there is something called preconception counseling, and that is where you evaluate a woman, and in that evaluation, you identify women that are going to have a high risk pregnancy, and some of them it is so serious that you even advise them not to get pregnant. Typical example: if a woman has a very high blood pressure, before she gets pregnant, you already know that she's going to have a high risk pregnancy. If she has a diabetes mellitus with poor sugar control, poor blood glucose control, if she has a heart problem, if she has a renal problem, that woman is going to have a high risk pregnancy. If the woman also is above 35 going to 40 years, we call them elderly pregnant women. That woman is going to have is a high risk pregnancy. If a woman wants to get pregnant by IVF, usually they are above 40 years in most cases. They are usually advanced in most cases. Uh, uh, an IVF pregnancy might be a high risk pregnancy also. Then for other women also, women that have had maybe two previous surgeries, a previous removal of fibroid as a myomectomy, previous cesarean
Okay.
section. They are women that even before they get pregnant, you already know that these women are high risk. women, so their pregnancy are going to be high risk. So even before they get pregnant, these women, you can identify them, advise them, and inform them that their pregnancy are high risk and should be managed as such. Okay, over to you, moderator.
Okay, okay, thank you very much, sir. How about those persons that usually suffer from what's called hyperemesis gravidarum, that experience excessive vomiting and all because of pregnancy and sometimes become bedridden? Do you also classify those persons as high risk pregnant women?
Okay, first of all, there are different levels of vomiting in pregnancy. We have vomiting in pregnancy is actually a very common symptom. Having the feeling of vomiting and vomiting in pregnancy, they are common symptoms that most women may experience in the first 3 months of pregnancy. Now, vomiting in pregnancy is usually due to human chorionic gonadotropin. Now, it is expected that in the normal course, after the first 1 month to 2 months to 3 months, the woman has experience, and by the time she is crossing the third month to fourth month, the vomiting begins to drop. Now, hyperemesis gravidarum is not a normal vomiting in pregnancy. Most people that vomit in pregnancy, they claim maybe they have read somewhere they say hyperemesis gravidarum. No, hyperemesis gravidarum is severe vomiting in pregnancy, and it is characterized by certain parameters. One of them is the woman having an abnormal renal function as serum, electrolyte, urea, and creatinine begin to change. The woman begin to have ketones in her urine. The woman also has to lose about 10% of her body weight. When a woman begins to experience any of this, that is when you say the woman has a hyperemesis gravidarum. So it's not really a common situation. It's something that is diagnosed when there is severe vomiting in pregnancy. What most women experience are most are just vomiting, nausea, and vomiting in pregnancy. They are not actually hyperemesis gravidarum. Now, hyperemesis gravidarum too, when it occurs, it puts the woman at a high risk at that point in time. However, most women, after that period of hyperemesis gravidarum, if the symptoms resolve after the hormone goes down and after medication and care for the period, they may end up having a normal pregnancy for the remaining part of the pregnancy. So that at that point, they are having that it's actually a high risk pregnancy.
Okay, okay, thank you very much, though. Now, when it comes to management, you kept saying visit a tertiary hospital. I wanted you to break that down for the layman. When you say tertiary hospital, what does that mean?
Okay. Now there are categories of pregnancy. Okay, there are categories of healthcare system. First of all, you have the primary healthcare system, healthcare. You have the secondary, and you have the tertiary. There are pregnancies. If a pregnancy is not normal, you have no business managing that pregnancy in a primary healthcare setting. And every hospital has its particular designation. If you want to manage a high risk pregnancy, it should be managed in a facility where you have a specialist, where you have the persons involved in managing that condition. For example, you shouldn't go and manage a hypertension in pregnancy in a hospital where you will not see a gynecologist, where you will not see a cardiologist to manage the heart and a gynecologist to manage the pregnancy, because that pregnancy is high risk. You can't have an abnormal lying placenta and you are managing your pregnancy in a hospital that does not have 24 hours availability of blood and aesthetic service and special care baby unit service. So when I mean tertiary center, it's a center that has all the requirements in managing a high risk pregnancy. They are not necessarily going to be a teaching hospital. Although when you say tertiary, most times people refer into those teaching hospitals. But no, there are big hospitals that actually have the basic requirements of managing such high risk pregnancy. And these basic requirements include the availability of a gynecologist or obstetrician, availability of an anesthetist, 24 hours blood transfusion service, 24 hours neonatal care service, 24 hours theater services, and also availability of specialists in the necessary areas that affects the pregnancy. If it is diabetes mellitus, you need an endocrinologist. If it is a hypertension in pregnancy, you need a cardiologist. If the woman has renal failure, you need a nephrologist. So that is what we mean by a tertiary center, a center that has the requisite specialists to manage the pregnancy.
Okay. Okay. Thank you very much, Doctor. That's clear. So at this point, I think we'll open up for the audience if there are any questions from our audience. We'll take them now. Any questions from the audience? Let's check. Do we have? Okay, I don't think we have any question. So far, I don't think we have any questions from the audience. Okay, okay, good. So that's saying yes. So far, we have no questions from the audience. So, sir, in a wrap, since we don't have questions at this point, in a wrap, what's your words, your final words to women who have been diagnosed, right, as high risk pregnant women, and then for others who might have this experience in future? Because, like you've mentioned, you said something about pregnancy being a dynamic experience, such that even a normal pregnancy can become a high risk pregnancy in the course of the journey. And so, what would you advise women out there, both the ones that are being diagnosed as such, and then the ones that are not in that experience at the moment or do not have such experience?
Now, I am very happy you got that point, that very point there, that pregnancy is very dynamic. And that's the most important thing about managing pregnancies. At every point in time, a pregnancy that is normal can change rapidly from low risk to very high risk pregnancy. So, first of all, every pregnant woman should seek care in a reputable hospital, a hospital that has a certified doctor with experience in managing pregnancy. Reason being that it might be in the course of the pregnancy that the woman will discover that her pregnancy is high risk or her pregnancy might change. So you need a doctor to evaluate you and identify the risk and refer you appropriately. So the first point of call is that if you are pregnant, don't manage your pregnancy at home. If you are pregnant, don't go and start taking drugs from one pharmacy somewhere without going for antenatal clinic. And when you register for antenatal clinic, please be regular with your clinic. Now, also when you are referred, make sure you go to where you are referred to so you can have a successful delivery. If for any reason before your pregnancy you have been told, you have been counseled that your pregnancy will be high risk based on your current status, maybe your age, your previous pregnancy history, previous surgery, presence of medical conditions. Now, such person should also choose to manage their pregnancy in a center where they have an obstetrician and a requisite specialist to manage their condition. Preferably, you can go to a teaching hospital. It's not every pregnancy that you go to a primary health care to manage. If already from the start, for example, you have hypertension, you have diabetes, you are over 40, you've had previous surgery, those are not pregnancies you go and start managing in a primary health care center. You go straight and register with a tertiary health center. So, in conclusion, as a wrap, I will say that the only way we can stop our women from dying is by managing the pregnancies appropriately. The things that cause death in
Okay.
pregnancy are things we can prevent. We can prevent primary postpartum hemorrhage. We can prevent the cause of death from hypertension in pregnancy. We can prevent infection. And also, there is something that is also common and can also cause death, which is ectopic. If you're a young lady, you miss your period, and you know you are sexually active, it's advisable that you do a pregnancy test and do a follow-up scan to be sure that the pregnancy is in the right place. Because if you have an ectopic pregnancy, it's ruptured and is poorly managed, it can also be a cause of serious morbidity and even death if appropriate actions are not taken. So
Okay.
that'll be
Thank
all for
you.
that.
Thank you very much, sir. Thank you very much, sir. I
Okay,
really appreciate
thank
the
you,
session.
Dr. Sophia. Okay, thank you, Dr. Sophia.
Personally, I learned a lot, and I'm sure everyone that joined us and for all that will be joining us after this live, they have a lot to learn. Thank you so much. I'm sure our audience have got one or two tips about pregnancy. And once again, just as a reminder, why we started this whole education on pregnancy was because there are persons that are literally dying from these little things, right? Someone has an ectopic pregnancy and just felt it was just little pain and just left the whole thing and then lost life in the course of complications that arose from that. There are persons that lose their child at the end. That for me was like a very big deal because I don't know if you carry the pregnancy till delivery. I believe everything at the point of delivery can be managed if detected early. Detected early. So please, for all our audience, you've heard it directly from the doctor and from the specialist. I should say that from the specialist in the house. Please, if you have health concerns, you have history of the things mentioned, hypertension, diabetes, and the rest, it's best you work with a tertiary institution when you conceive. And also, it's best you monitor the entire time of your pregnancy. And so we'll call it a wrap at this point. Thank you very much, sir, for joining us. Do have a lovely evening as we
Thank you
allow
for
you go
inviting me
at
also.
this point. All right. I hope we can see you some other time on this live.
Hopefully, hopefully, I'll be able to make myself available.
Thank you very much,
Thank
sir.
you very much.
Uh,
Thank you.
so, sir. So, for everyone that joined us on this live, thank you so much. We are happy to have had you with us. Please share the link to this session with your friends and families and let them know that no matter how. Yes, thank you very much for joining us, Success Martin. So please let your friends and family know that no matter what it is, pregnancies, the casualties that arise in pregnancies can be avoided. Like even if it's high risk pregnancy that was diagnosed from the beginning, from the get go, perhaps due to health conditions and all, everything can be managed, but it has to be detected early, and you have to work closely with the right doctors, the right persons, right? Like our doctor has shared with us. So that'll be all from me tonight. I'm inviting you for our next episode on this Ask a Doctor series, which will be happening next week, Saturday, hopefully. Or if we have to do Sunday at the request of the doctors, please, we will have to adjust the time, just considering their schedule. And so please be a part of it. Invite your friends, invite every pregnant woman in your space to be a part of this because you would be saving someone's life without knowing by simply doing that. So that'll be all from me tonight. You guys have a lovely night rest. All right. Good night.